soon we are joining with the webinar. We are actually waiting for the participants to join. Good afternoon. We are joining soon. We are just starting with the webinar.
A very good afternoon. I would like to welcome you all for attending this webinar. I, Ms. Pooja Bhagri, Assistant Professor at Ruhelkand College of Nursing, Bareilly. I feel delight to welcome the one who act as a pillar of support and strength of our college, our principal and vice principal. I welcome you, ma'am. A warm welcome for all the dignitaries. It's my gratitude to all the principals who gave the faculty and students the opportunity to attend this webinar. So without taking much time, I would like to welcome our speakers, Mrs. Preeti, Assistant Professor at Ruhelkand College of Nursing, Bareilly. I extend my warm welcome to Mrs. Chand Prabha, Nursing Tutor, Ruhelkand College of Nursing. I request all the participants to stay connected with the webinar as today's webinar is going to be very informative and useful for all of us. So without delay, I would like to introduce our today's theme, Clinical Trial Contingency Course of Action. For starting today's webinar, I feel privileged to extend my warm welcome to our speakers, Mrs. Preeti, Assistant Professor, and Chand Prabha, Nursing Tutor at Ruhelkand College of Nursing, dealing with the video demonstration on bandaging. So just we are starting for the video demonstration on bandaging.
Good morning to everyone, those who are connected with the webinar.
This is Preeti Bhogra, Assistant Professor, Rohilkhand College of Nursing.
And I, Chandraprabha Joshi, Nursing Tutor of Rohilkhand College of Nursing.
Today we both are going to present a topic that is on bandaging. So let's start the topic.
So before going to start, we have to know about a bandage. A bandage is a piece of thin cloth used to bind or wrap an injured part of the body. Bandaging. So it is basically a technique, or you can say a procedure or a process of covering a wound or an injured part with the help of any gauze piece or any cloth material. So we have different types of bandages: triangular bandage, roller bandage, and a special bandage that is T-shaped. Triangular bandage. It is made up of by cutting diagonal a square piece of cloth 40 inches in length. The longest side is called the base. The corners directly across the base is point, and the other two corners are ends. Different ways to use the triangular bandage, such as in head or as arm sling. Roller bandage. It is a tightly rolled circular bandage of varying width and material, often prepared commercially. It can be applied to almost any body part. It has two surfaces, rolled one head and unrolled is tail. Here you can see the different techniques of roller bandaging: circular, spiral, reverse spiral, figure of 8 and spica. T bandage. It is a special type of bandage. It's shaped like the letter T and used chiefly about the waist or perineum to hold a dressing in place. Principles of bandaging. Select a bandage of proper size. And suitable material. Provide comfort while we are doing the bandaging. with the help of pillow or either other comfort devices. Support the area, especially the injured area, while we are doing the bandaging. Hold the roll of bandage in right hand and unroll few centimeter of bandage at a time. Keep the edges parallel. Face patient while applying bandaging, except the head bandaging. Do not apply too tight pressure while bandaging as it can interfere the circulation and may cause carpal tunnel syndrome. Leave the fingers and toes exposed to check the circulation. Always start the bandaging from narrower part to the wider part. Whenever we are going to open a bandage, firstly twist the bandage roll and then gently remove the wrappers. When we are going to start the bandaging, make 2 circular turns to begin the bandage. Continue spiral turns at about a 30-degree angles and terminate the bandage with 2 circular turns and secure it with different materials such as metallic clips, either with safety pin secure the end with adhesive tape for making knot over bandage. Cut the tail end of bandage in equal half. Tie a single knot and cross each half of bandage towards opposite side of wrist. Bring end of bandage around wrist and tie with square knot. Secure the knot with adhesive tape. For untying the bandage, first remove all the metal clips. Grasp one of the folded end and open the bandage roll carefully. Here you can see how to make a granny note. After tying the note, secure the note with adhesive tape. There are different sizes of bandages which can be used and select according to the injured body area and according to the size of wound also. As you can see, in wrist and foot we can use 2-inch bandage. In elbow, ankle and knee we can use 3-inch bandage. Lower leg and shoulder we can use 4-inch bandage. For chest we can use 6-inch bandage. Good morning to everyone, those who are connected with the webinar.
This is Preeti Bhogna, Assistant Professor.
Start the demonstration of bandaging procedure. First, identify the patient. Explain the procedure to the patient. Provide comfortable position to the patient. Check physician order for any specific instruction. Privacy should be maintained. Arrange the article at the bedside of the patient. Perform hand washing. Articles required for bandaging. First, a pair of gloves, kidney tray, scissor, adhesive tape, paper bag, gauze, 6-inch, Crepe bandage 6-inch with metal clips. Crepe bandage 8-inch. Hand sanitizer and a triangular bandage. The longest side is called the base. The corner directly across from the base is point and the other two corners are ends. So let's start with the different types and techniques of bandaging. Firstly, inspect the area. Provide comfort devices for support such as pillows. Technique comes under roller bandaging is circular bandaging. Apply the end of the bandage to the part of body to be bandaged. Encircle the bandage covering 2 circular turns. Each turn directly covering the previous turn. Circular bandage is used to hold the dressing on even cylindrical body parts such as arms, legs, chest, or abdomen. Cut the bandage and secure the end of the bandage with tape, either metal clips or safety pins over an uninjured area. Next technique is spiral bandaging. Start the dressing from the narrower part and wrap upward and toward the wider part. Make 2 circular turns to begin the bandage. Continue spiral turns at about a 30-degree angle, each turn overlapping the preceding one by 2/3 the width of the bandage. Terminate the bandage with 2 circular turns. And secure the end with tape, metal clips, or a safety pin over an uninjured area. Spiral bandages are used for uneven cylindrical parts of the body, such as fingers, lower part of leg, and forearm. Reverse spiral bandaging. Begin the bandage with 2 circular turns and bring the bandage upward at about a 30-degree angle. Place the thumb of the free hand on the upper edge of the bandage. The thumb will hold the bandage while it's holding on itself. Continue the bandage around the limb, overlapping each previous turn by 2/3 the width of the bandage. Make each bandage turn at the same portion on the limb so that the turns of bandage will be aligned. Terminate the bandage with 2 circular turns and secure the end. Next, figure of 8 bandaging. Begin the bandage with the 2 circular turns. Carry the bandage above the joint, around it, and then below it. making a figure 8. Continue above and below the joint, overlapping the previous turn by 2/3 the width of the bandage. Figure of 8 is used to retain dressing, to exert pressure for joints, to fix planes for the foot or head, such as ankle, elbow, knee, hands, and foot. Terminate the bandage above the joint with 2 circular turns and secure the end appropriately. Next, triangular bandaging. Arm sling. Support injured arm slightly away from the chest with the wrist and hand slightly higher than elbow with other hand. Place the one point of triangular bandage between the forearm and the chest with its point toward the elbow and stretch well beyond it. Pull the upper end over the shoulder on the uninjured side and around the neck. Bring the lower end of the bandage over the hand and forearm and tie both the neck at hollow above the collarbone. Put a cushion pad under the note. Bring the point around the elbow and secure it to the sling. Check the signs of circulation loss, that is pulse, fingernail, color. The hand should be in a thumbs up position within the slings and slightly above the level of elbow, that is about 4 inches. Before move to the collar sling, let's know about the note, that is clove hitch note. It is a type of note along with the bowline and the sheet bend. It is often considered one of the most important notes. It is more effectively used as a crossing note. Here we will use this note for collarbone or shoulder sling. Make a clove hitch using a narrow fold bandage. Put the loop over the wrist of the injured arm. Gently elevate the injured arm against the casualty chest. Tie the bandage end together around the neck on uninjured side using reef note. Place the pad under the note. Triangular bandaging to the head. Turn the longest side, that is base, of the bandage up and center its weights on the center of the forehead. letting the point, that is apex, fall on the back of the neck. Takes the end behind the head and cross the ends over the apex. Take them over the forehead and tie them. Tuck the apex behind the crossed part of the bandage and secure it with a safety pin if available. Triangular hand bandage. Place middle of base of triangle well upon palmar surface of wrist. Carry apex around end of fingers. Cover back of hand to wrist and tuck excess fullness of bandage into small plates on each sides of hand. Cross each half of bandage toward opposite side of wrist, being ends of triangle around wrist. Tie end with knot. Secure the end of the bandage with tape or safety pin over an uninjured area. Next, you can see how to make a reef knot. Hold the end of bandage in each hand, cross the ends under in the right hand and then over the end in left hand for make a turn. Cross the end over the right hand and then under the end in the left hand making a second turn. Knot should be made where it does not hurt the skin. Tuck the close ends of bandage to give a tidy appearance. Replace all the articles at proper place. Document the procedure in the nurse's note. Provide comfortable position to the patient. Assess and ask the patient for any pain or discomfort. Perform hand hygiene. Head bandaging with two bandages. Before going to start, we should prepare the bandage. Either we can overlap the two ends of bandage or we can simply tie the ends of bandage together with reef knot. While we are doing head bandage, we are always stand at back. Then place note over the forehead and bring both rolls back above ears. Cross bandage at the back of head. Bring roll number 1 upward over the top of head. Bring roll number 2 around the head over other bandage and around to the side of head. Bring roll number 1 from forehead over top of the head to the nape of the neck. Bring roll number 2 over fold of roll number 1 at the nape of neck junction and continue around to the front. Bring roll number 1 back over the top of head and repeat the procedure alternating to the left and right of the midline and each turn overline outer half of the preceding turn. Cover head, bring both roll to front with circular turn around head. Tie the ends of bandage with reef knot. Cut the extra edges of bandage with scissor. And secure the end with adhesive tape. Head bandaging. This bandage is used to hold a dressing on the scalp. For this, we need an assistant. Here we will use one bandage and the size of the bandage is 4 inch. Anchor bandage with 2 circular turns around the head. At this point, hold bandage upward with assistant, holding fold in place with finger. Continue bandage over top of the head to center of forehead. Fold bandage back at this point and hold it there with free hand. Carry bandage back to point held by assistant at rear of hand. Continue procedure until entire head is covered. Turns alternating to the left and right of the center. and each turn overlying the outer half of the preceding turn. Apply 2 circular turns around the head, covering the ends of the initial turns. Secure the end of bandage with either adhesive tape or metallic clips. Eye bandaging. This bandage is used to hold a dressing on the eye. The size of the bandage used here is 4 inches. Anchor the bandage with 2 circular turns around the head. Then bring obliquely down across back of head. Bring under ear on side of injured eye and obliquely up across cheekbone to bridge of nose joining primary turns. Continue around head for 1 turn. Repeat procedure, each turn overlapping the upper outer 2/3 of preceding turn until eye is covered. Apply circular turns around head and secure it with the help of adhesive tape. Ear bandaging. This bandage is used to hold a dressing on the ear. The size of the bandage we are using here is 4 inch. Lay the outer surface of bandage against forehead and carry the bandage round the head with 2 circular turns. Turn the bandage and bring obliquely down. Covering the ear with gauze slightly down the previous turn. Turn the bandage upward from the occiput area and again repeat the turn 2/3 slightly down the previous turn. Cover the injured area completely. Make 2 circular turns over forehead and secure end with tape or metal clips. Make sure that the injured part should be completely covered. Finger bandaging. The finger bandage is used for holding dressing on finger. Use one comfortable device such as pillow for giving support to the hand. The size of the bandage used here is 2 inch. Anchor bandage at wrist and make a 2 circular turns. Bring over back of hand and make one complete turn at base of injured finger over dressing. Make another spiral turn back to base of finger from up to down. Complete bandage with finger with figure of 8 proceeding from tip to finger base. According to the injured area, we can cover the fingers. Terminate with 2 circle turns around wrist and secure it with tape. Next we will see spica. Spica of shoulder. It is used to retain dressings of the shoulder and armpits. Here we are using the size of bandage which is 6 inches. Take 2 circular turns around the upper arm. Take bandage down around the chest. Bring it up over the shoulder and come back to starting point. Repeat the turn little higher and above 2/3 of the previous turn at 30-degree angle. Continue this by covering the complete shoulder area from downward to upward. Make 2 circular turns and secure the ends with metal clips. Bandage. For making it, we required gauze, adhesive tape, and cotton pads. These bandages are used to secure dressing to parts which do not let themselves to roller bandage application. The T bandage is a T-shaped bandage consisting of a vertical strips of material or pinned to the center of horizontal strips. T bandage consists of two strips of flannel about 4 inch wide, stitches together in the form of T. This bandage may be used as a scalp, eye, ear, or in perineum. So stitches together in the form of T. You can place cotton pads over vertical strip secure the cotton pads and apply one sterile gauze over it. The horizontal strip is made long enough to pass round the body, and the vertical strip is passed between the legs. It is then pinned to the horizontal strip to keep perineal dressing in position. Or either you can tie both the horizontal strip togetherly and tie both the vertical strips over the horizontal strips.
To express the gratitude, I would like to invite Mr. Manoj Kumar, Assistant Professor, Ruhelkhand College of Nursing. It's over to you, sir.
Thank you so much, ma'am. We all are grateful for your effort. The topic was very informative. Thank you, ma'am.
It seems to have covered all the portion of bandaging. I would like to invite Mrs. Renuka ma'am, Assistant Professor, Ruhelkhand College of Nursing, for vote of thanks.
Thank you, ma'am. Good afternoon to one and all who gathered today for the webinar. It is a matter of pride for me that I got a chance to thank everyone. First and foremost, I would like to express my gratitude to Principal and Vice Principal of Rohilkhand College of Nursing, Bareilly, for providing their continuous support to us. My heartfelt thanks to all the principals of esteemed organization for giving their expensive time to attend the webinar. Also, I would like to put out my gratitude to our speakers for providing such a valuable knowledge. I also give my sincere thanks to all the participants attending the webinar. Not least of all, I enjoin my gratitude to the organization team, that is our organizing chairperson, organizing secretaries of the webinar, and all the office staff, and also to the technical team members for the good collaboration for making the webinar successful. Thank you all.
Thank you, ma'am, for your valuable words. If any student have any question, can write and send into the comment box. So there is no question in comment box. I request all that the webinar is over, and thank you all for joining and listening us. The e-certificate will be provided on your mail ID. Thank you so much.